Okay, it's 7:01 and I am calling the meeting to order. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, December 14th, 2021, on the Zoom platform in accordance with the town's policy directive and guidelines issued on April 1st, 2020 as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We'll start with an attendance roll call. We'll announce your name, please reply. And for members of the public, please unmute yourself when I've opened the meeting to public comment, excuse me. Dr. Green.
Present.
Mark Haddad.
Present.
Okay, Ray Considine.
Present.
And Alma Healy.
Present.
And Jill Block. I am here. Thank you all for coming. Next, we have a request for a variance for 208 Bedford Street, and I believe we have Ted Doucette here to talk to us about that.
Yes, good evening. Ted Doucette representing the owner, Douglas Brown, who is also here observing. So what we have here is a very small, it must be some historic lot because I don't know how it would get approved today under, under zoning. It doesn't have frontage, and it's only about 7,700 square feet. It has a steep slope coming down from the back. So this is Bedford Street across from, I don't know what, was it the cemetery there, Sleepy Hollow Cemetery, the far end of it as you're leaving town. It's a rear lot. I can share a screen if you want to see it, if you don't have the plans up, but it's just a very small lot. It has a house with a detached garage, which takes up space. And then the rear of the lot slopes down quite a bit. So there's really only one place to put it. It's actually a nice little spot next to the garage where it's gentle sloping. Lots of sand and depth to groundwater. But we, in order to maximize compliance, maximum feasible compliance, we are trying to make the system of sufficient size for, to ensure sufficient treatment. And that requires us to get closer to the lot line than Title V requires. Stop me anytime. I'm just going to keep rolling.
I was going to say, you can show your screen if you want, Ted.
Okay. So you can see Bedford Street down here, and here's this common driveway. This is 208 Bedford, obviously 210 Bedford right here. And here's the garage. And as I said, it slopes down here. This area back here slopes down a little bit too, but this area right here is a nice little spot for the septic system. Right now, the system comes out the back. We're going to reroute the plumbing internally to come out the side, go into a septic tank, and then a pump chamber, and then pump up to this leach field. This leach field is a Presby system. I use them a lot when we're on slopes. It's really nice because you can slope and it takes up less room than step trenches. And I think it's easier to build too, especially in this sandy material. So it's a Presby bed. We have this lot line here, and our 5-foot over excavation, if necessary, is going to bring us right up to that lot line. Regarding the lot line survey, I found the record drawing at the Registry of Deeds, and I found 2 bounds out there to tie into, and I found other records from other surveyors marking out this lot line. So I feel we're sufficiently meeting the requirements of having a PLS because the record drawing is stamped by a PLS, and I found documentation, or I found field records of that plan to tie into, and my math worked out that my survey was accurate enough to feel that I'm confident that this is the line. And I'm ready for questions.
Susan, do you have anything to add?
I think this represents maximum feasible compliance for this lot. There's no addition of design flow. It's a simple repair. The leach field is in the best place you could put it for this lot, and a variance to a property line is not a big variance to grant. It frequently happens under maximum feasible compliance. So I recommend approval.
And it looks like this was an upgrade to an existing failed system, and it sounds like it's an improvement on some levels. Is that accurate?
Yes.
Okay. Okay. Are there any questions? Okay, in absence of that, do we have oh wait, is there a question?
Someone might have just unmuted. Mr. Adams, are you in a butter?
The lot in front, I don't know if this is the appropriate time to ask the question, and I'm very ignorant about this process, so forgive me if it's not the right vein, but with the variance, because we also have a septic that probably needs updating soon, would that in any way prevent us from also having a septic system that's fairly close to that lot line?
Susan?
Madam Chairman, I'm not sure who they,
I
yeah,
don't
if you want me to address that.
Yeah, why don't you address it, Ted?
Yeah, so the typical setback is 10 feet. So we're going to be at least 5 feet from the lot line. So if you had to get within 5 feet of the lot line, then we'd have that 10-foot separation between systems. And you have a similar area over there of a larger space, next door. That front lot area, your lot, where you have your, we have fenced in. That's adequate space if it's the same material. And, based on my knowledge of the area, you're going to have plenty of room there with sand and things. And, keep my name. I'd be happy to help you out with it anytime.
Mr. Adams, can you state your address, name and address for the record, please?
Sure, my name is Coleman Adams, and we're at 210 Bedford Street.
Okay, thank you. Okay. Any other questions? Okay, do we have a motion for approval then?
I move to approve the variance at 208 Bedford Street.
And a second?
I
I
second.
second that.
Okay, all in favor, roll call, Alma,
I said, yes, I approve.
Ray,
I approve.
Deb,
I approve.
Mark,
I approve.
and I approve. Okay, all right, thank you for your time.
Thank you very much for your time. Yep. And Mr. Adams, if you have questions anytime, just call me about this system or construction, anything, just give me a call. We can coordinate.
Great,
But thank you for your time. Have a good night.
All right, thank you all.
Thanks, Ted.
All right, next there's a discussion of White Pond and the APOD system to remediate toxic algae blooms. And I know that we are no longer being asked for our input on this, but it's on our agenda. And Susan, if you can give us an update on where that stands.
Yeah, I would love to. So the White Pond Advisory Committee had initially put in a request to the Community Preservation Committee for $30,000 or $35,000 to fund installation of the APOD system at White Pond for next summer. And if you look at the PowerPoint presentation that I sent you from the White Pond Advisory Committee, and you look on page 6, there's some really nice pictures of the APOD. It's a floating boom and net system that's installed in the pond that concentrates and removes the toxic the cyanobacteria, the harmful algae blooms. So it's very low tech. There's no chemicals involved. There's no real disruption to the water column. And was piloted this summer by John Higgins of Higgins Environmental. We think it's promising. And the town has decided to put the funding for it in the FY23 budget. So instead of the Community Preservation Committee needing to fund it, the town is going to fund it. And I sent you John Higgins' preliminary report from this past summer. And, if it works, it removes the algae that potentially create toxins. It removes all the nutrients that the algae have taken up. So it's a great way to remove the pool of nutrients from the pond. And it could be a really relatively low cost, low tech solution to some of the problem with the algae blooms out at White Pond.
That's good.
Great. I know that in the initial request that we were being asked for a letter of support. Is there any action that the Board of Health still needs to take on this?
No, because it's going to be in the town budget now.
Okay. The other thing I noted in the initial background was that one town department, either natural resources, public works, or health, was going to be designated to oversee and manage the project. And I wonder if you have any sense of how that decision is going to be made, what that might require, what if we need to follow up on that particular action.
I don't think any follow-up from the Board of Health is required. I believe Natural Resources is going to oversee it, and I may come on as a consultant to project manage that. And Nancy Leland from UNH, who's the person who does a lot of the cyanobacteria research, has put together a sampling plan for this coming summer that will both sort of advise the town on sort of better characterize what the blooms are and what's causing them to occur, and help in making, well, it'll give us the cell counts that we need to, that's in the DPH protocol for the public health water use advisories. So I may likely project manage her sampling program and the APOD program. John Higgins and Nancy Leland know each other well, they work together. So that the two projects will kind of dovetail. And since my replacement has not yet been found, and we don't know how much that person may know about blue-green algae, and I've been doing this since 2015, I may just project manage both of those projects.
Great. Well, it'd be nice to have you around to help.
Which I'm excited to do, because before I was in public health, I was an environmental scientist and a biologist. So I might get to do biology again.
Nice.
Jill, while we're not required, because the point is moot at this point, but would a letter help in terms of an endorsement when it comes to the town budget, or is that not necessary?
Sure. I mean, it couldn't hurt.
Or a vote that we endorse this, a statement that we endorse it?
I think that's a great idea.
Ray, do you want to make a proposition then, a proposal for that?
Someone has
well-
their hand up.
Oh, yes. Josh, if you can introduce yourself, please.
Hi, I'm Josh Calper, 65 Stone Root Lane in Concord. I'm also co-chair of the White Pond Advisory Committee. I just had a couple things to add. I agree with everything that Susan said. I just wanted to add that we actually had the APOD in use last summer from a National Science Foundation grant, and the results were preliminarily quite positive for cyanobacteria removal. Also, that it is our understanding that the Natural Resources Group, that Delia Kay will be officially the manager for the project, as she was last summer. And lastly, I want to add that a letter of support would be quite welcome. We are one of the pioneers in Massachusetts of using this technology. There are a few other ponds that benefited from the National Science Foundation study last summer, and we'll be implementing it again this coming summer. But this is the kind of thing that if a letter of support from yourselves could wind up getting this into something like the Massachusetts state budget, could make it really more of a common technology in use at ponds across the Commonwealth. So just wanted to add those things. We also really appreciate the town finally in the end deciding that it would fund the APOD as well as water testing in White Pond from the town's budget.
Okay, thank you.
Thank you.
So a letter. Who would like to take a stab at drafting something?
I don't know that you necessarily need to write a letter. Maybe
You take a vote on
let
that.
FinCom know that you support it, that
Okay.
you took a vote to support it.
Okay, so Ray, you were about to make a proposal on how that would be stated.
Sure. I'd like to make a motion that we endorse the inclusion of the $35,000 sum to continue to test concept in White Pond with the algae bloom remediation, or something along those lines.
We'll just,
I would second that.
Karen, did you get that?
yeah, the Concord Board of Health is going to voted to endorse the funding in the amount of $35,000 in the general town meeting budget for funding of the APOD technology to remove cyanobacteria from White Pond.
I wouldn't put the specific dollar amount. I think in the materials it was actually 36. And I think I would just say supports funding the implementation of the APOD system in White Pond for, the upcoming season.
Okay, supports funding of the APOD system in the town budget.
Okay, and
Second.
all in favor? Mark,
I approve.
Deb,
I approve.
Ray,
I approve.
Alma,
I approve.
and as do I. All right, thank you all. Moving along, next on the agenda is our review of Deborah's Next Door signage, sanitizing and staff monitoring protocols. I know that we have Deborah Stark here. I know that you've submitted a lot of drafts of some of the signage that we requested for the variance. We asked you for clear signage for customers that containers being brought from home must be clean and sanitized, allergen awareness, a plan for how staff will monitor, and a plan for cleaning utensils, which are handled by customers daily. Susan, I know that you've asked us for whether we are, we believe that whether we're comfortable with the signage that's been submitted so far, the draft signage. Do you want to expand on that introduction?
So I thought, there's been some back and forth between Ms. Stark and myself about what the verbiage for the signage should be, and the protocols that the board required. So I thought it would be best if you all looked at it and either gave it your blessing or suggested the changes that you wanted to see to meet the conditions that you placed on the variance.
Okay. I noticed one thing. I noticed a couple of things. When we talked at the last meeting about the variance, one of the things that came up in that discussion was a listing of the types of containers that would be acceptable for people to reuse. And I'm wondering whether that, if there's a plan for that to appear anywhere in the store. It wasn't one of the conditions on the variance, but it was part of the discussion that we had. And I'm just, that is a concern I have about whether, people will just bring in anything and all, or whether there's going to be some guidance on that. I did have some concern about the lack of a plan for how staff will monitor customers' containers. There isn't really a plan for that. You state that you do not want to have a plan for that, actually, but it was one of the conditions. So I actually personally would like to see a little bit more thought about how that could be done. There were other, I was looking at the allergen disclaimer, and it's interesting if, in bold letters, 3 paragraphs down, it says, if you suffer from life-threatening allergies, we do not recommend shopping in our zero waste store. I actually think that should be the lead, not lower in there, so that somebody is not walking in right away and starting to shop. Anyway, those are some of my initial thoughts. I wonder if other people have comments on some of the signage.
I thought the signage was good. I think it's, it's probably easier to see things in action than sort of looking at all the signs, but I was pleased with it. I think that's a good idea to have the allergy disclaimer at the top. I think that's a good idea as well.
Would you eliminate that first paragraph as the majority of our food? Just eliminate that first paragraph and start just go with the bold?
I think so, because you kind of get the message across in the next one that, that you're doing what you can to keep allergens separate, but they are there, right? Yeah. Somebody or other is going to be there. So yeah, I don't think you need to have that first one. but I would move that third one to the top. You know, and I know that I don't know if you have a layout of the store yet, but it would be helpful to know where these signs are actually going to be within the store. Have you laid it out yet? You probably
Yes,
have.
and I know that question was, I guess Susan asked us where we were going to put the signs, and I said that I'm the type of person who moves the sofa several times to get it where I want, but we are going to have pillars in there. We are going to have some wall space. So I had said that I thought we would have signs in various places. You know, we haven't mapped out where the signs are, but I'm happy to give anybody a walkthrough and get recommendations.
And were you planning on having any kind of guidelines on what are acceptable containers? Because I believe, as I looked at the minutes, you were the one that mentioned the types of things that would
Yeah.
be.
No, I think in the original submission to obtain the variance, we said, you know, glass and stainless steel, and we were eliminating things like old yogurt containers or old ratty plastic bags. So, but also cloth bags, because some people like to put their grains in cloth bags. So we were going to use common sense with that, but if it makes everyone feel more comfortable, we can certainly say here are the types of containers that are acceptable.
I think it will save you, you know, responses from people if you have it up front. You know, if people can see it when they come in, what is it, what's okay to use and what's not. That would
Okay.
help. You
So-
know, go ahead.
Sorry. So
No, go ahead.
that's, it's glass and it's stainless and it's cloth. I mean, those are, I think, the basic containers that people will want to bring.
In your, if I may, in the minutes, according to what was submitted, was washable containers, glass jars, stainless steel, plastic containers, cloth bags, and polyester food storage bags listed as such. So do you want those bulleted?
I mean, I think we'll have that sign and we can certainly list all those things that I originally had mentioned and when we were trying to get the variance.
So just to clarify, Deborah, you're
Yeah,
not going to let people bring things like used yogurt containers and things like that. You're not going to let them bring in clean reused plastic containers.
yes. So Karen reminded me that that's what the original wording was. So that's what I'd like to stick with. You know, many of us have old Rubbermaid from years ago, and I think that's still fine as long as they're washable, easily washable in dishwashers.
Well, not to make too fine a point of it, but Rubbermaid is meant to be washed and reused, whereas things like yogurt containers and other single-use plastics are not meant to be washed and reused. So I just would like to be clear on what the board is going to allow so that we all are
So
clear on that.
when we were appealing originally, the wording was, you know, containers that are washable.
Which means that those yogurt containers are not washable.
Correct.
Okay. So how are you going to monitor that? Because that's something that you have not really been clear about.
The same way we have always monitored it for all these past years. If we see someone coming in with that, we say you're not allowed. And then in this case, we obviously will be able to point to a sign that says these are the containers that are allowed. But I can also say I don't ever remember anyone trying to bring in a yogurt container and fill it.
I'm thinking about just how you're going to be staffing this area. Like I think about all of the new, you know, stores like Home Depot and Target that have now moved towards more self-service checkout than cashiers, but there's usually one person roaming that area. Is that something that you're anticipating?
Yes, we have already hired someone. He started last week. He is going to be the zero waste, you know, project lead. And his job will be to manage that area. And he will have, I don't know how many staff he'll have yet, but he will have some staff and there will always be someone in that department. Not only to help people, but roaming to answer questions and to make sure things are done correctly.
And watching what they're using for
Correct.
containers then.
Yeah.
So would the board like Ms. Stark to put that in writing? As a response to condition number 3, plan for how staff will monitor customers' containers for cleanliness?
I would prefer something more specific than the answer that is currently in there, which is that, that you're not asking people about their showering or winter coats, but that, I would prefer that you actually do ask them about this, that this is something within your right and the board's request for monitoring. So that if that's part of their job description, that they should be monitoring proper containers and cleanliness.
We have always done that. I mean, we have never stopped anyone from coming in when they come in with cat hair on their clothes. We've never stopped anyone coming in who looks as if they probably should have showered that morning and didn't. I don't think any store in this country does that, but I can tell you that if somebody comes in with inappropriate, whenever they've come in with things that are inappropriate containers, we've always said, you're not allowed to. So I'm happy to, if you'd like me to try and put that in wording, I'm happy to try and do that. I'm very tired now, so I'm babbling a little bit, I'm sorry. But I don't know how anyone in any store in this country really has the absolute right to tackle every person who comes in who doesn't look squeaky clean.
We're not talking about the customer, we're talking about the container they're using.
So if we're talking about the containers, we do that. We had somebody come in with jars to fill with herbs and spices today, and we said to them, you cannot, those jars are not clean. So we do that all the time, and we did that today.
That's great, I'm glad, but yeah, it's not about personal cleanliness. It's really about something that's possibly coming in contact. And we recognize it's a low risk, but nevertheless, we want to make sure that we're protecting the public health. That's what our job is here.
So we need another sign in addition to the food allergy notice that talks about the containers that people can use and the condition which those containers have to come in.
That's right.
Correct? Okay,
Yes.
so we need another sign. All
Yes.
right.
Do other board members have other comments or thoughts on this?
Well, I just had a question. Is the the third condition that we requested, is the signage going to be the principal way of monitoring that, or will there be active employees checking the containers?
There will be active employees managing the area. And again, I don't see us stopping everyone as they come in and say, let me check your containers. But if we spot someone with containers that are not clean, that is our job to say, I'm sorry, those containers are not clean, just as we did today.
So that will, excuse me, so that will take place at the at that point of service, not when they're entering the store, but at the point of service where they're, okay.
Yeah.
Mm-hmm.
I think the only other thing I would say is that I think often a graphic is a little bit easier, just like 3 sort of images, like make sure your container is clean and dry. These are little pictures of, the typical containers at work. And then, the circle with the line through it over with, an image of the yogurt container or whatever. I think that's pretty self-explanatory. And I don't know, I get the sense that this won't be a big problem. I have a feeling the clientele are going to bring appropriate containers and sturdy containers and things like that. So, I mean, a used yogurt container isn't good for much of anything. So I'm not terribly worried.
That's good. Anything else then on this one? No?
No.
Good. Okay. Oh, and then we had the letter. We did draft a letter. Mark, I saw your comments earlier. Thank you. And it was just a little bit more clarity about the food code in it and just a couple of other changes. Did anybody else have a chance to look at it and have any other additional comments, edits? Okay. then I'll,
I did notice one thing, Jill, and I can't quite pull the letter up. Here we go. No, that's the wrong one. It sort of talks to the Department of Public Health about allowing reusable containers, but it doesn't specifically say for dry bulk foods. It just sort of is, let people bring clean containers from home for refilling. And I don't think the intent of the board is to suggest that people should be able to take containers from home for like takeout food or hot food from a deli line or something like that. I don't believe that's your intent, but maybe it is. If your intent is just bulk food, I think that should be stated.
mhm. I can do that. I'll integrate that.
Jill, I just had one question, and it was I guess it was the third paragraph down. When we're asking DPH to create a framework for citizens to make their own informed choices. I'm not quite sure what that means. Is there a way we can make that more explicit? Are we asking them to rewrite the food code? Is that the outcome? Is it, what exactly are we hoping for in terms of the framework?
I think you're right. I mean, this was a modified draft from what Deborah Stark had submitted to us in the beginning. And so, but I think you're right that we are asking DPH to basically change the code here along with the variants that we've granted.
So maybe we should be more explicit in saying, we're suggesting that the department rewrite the code as it applies to Massachusetts. Permitting, the sale of bulk purchases and things of that nature, as opposed to keeping it somewhat vague as it is.
You're absolutely right.
Yeah,
That's a good point. All right, what I'll do is I'll add that modification from Susan and that suggestion, Ray, and I'll get this back out to all of you for you to look at.
great.
Sounds good.
Okay,
Thank you for doing that.
sure. Thank you all. All right, I think we're good with this issue. This
Yes.
agenda item. Okay, all right, thank you for your time, Deborah. All right, next we have a discussion. We're on to issue number 6, which is COVID-19. It hasn't gone away. As when we, each month since, I guess, the fall, we've been looking at the issue of the need for mask mandates and based on any changes in epidemiology and the pandemic. And so I'd like to revisit that discussion based on what is going on. But perhaps before we do that, Susan, if you want to give us the update.
Sure. So I sent you the webinar notes from last week's webinar. I don't have this week's webinar, but I do have an update. One of the things that has just changed a lot is the case investigation and contact tracing, simply because the effort that public health has been doing for 21 months cannot be sustained. So now when we get a positive case, the public health nurse is going to make one phone call to the positive case, tell them, here's the 10-day isolation period, here's the day you can leave isolation, ask them about their close contacts. Since close contacts who are vaccinated no longer have to quarantine, there will be no follow-up for those people. The unvaccinated close contacts, the public health nurse will follow up and quarantine them. But a lot of the responsibility is now going to fall on the positive person to notify all of their close contacts that they've potentially been exposed and urge them to get tested. So that's a big change. With the focus remaining, so where they really want the focus to remain in terms of contact tracing and case follow-up is healthcare facilities, congregate settings, early childhood ed, K-12, higher education, and disease clusters. So Tricia, of course, has always been focusing her effort on the K-12 schools and the childcare centers, and she will continue to do that. But that is a big change going forward. And then the other thing that we're all, of course, talking about is the Omicron variant. As of last week, it's still more, the cases in the state are more than 97% the Delta variant. The state is concerned about a winter surge because of people going indoors, and they're kind of thinking that lower humidity contributes to the virus becoming aerosolized, which may account for more transmission in the winter when people are indoors. And then today's update on Omicron is there are now 16 known cases statewide, 10 female, 6 male, ages range from pediatric to age 60. 5 of those 16 were fully vaccinated. They're pretty sure that Omicron is more transmissible than Delta, and they're seeing more spread within families. And there are cases in Essex, Middlesex, Suffolk, and Worcester counties, and no hospitalizations yet. So
Good.
that's what we know from DPH. And then the other set of pictures I sent you, or graphics I sent you, are from the state website, just sort of looking at the case counts, what they're doing. They're clearly going up. The hospitalizations are up a little bit. And then the second page is sort of case counts by county. And then we have testing data, and Concord's 14-day daily incidence is 18.3, which is, if you look at the little map of all the towns that are color coded, we're low compared to many of the other towns in Middlesex County. In terms of how many fully vaccinated people are getting sick, the overall percentage is 1.8. So it's
Wow.
low statewide. Our vaccination rates are high. Our fully vaccinated people, you know, the 12 to 15-year-olds are greater than 95%. The 16 to 19-year-olds are greater than 95%. And it's in the high 80s, you know, and just about everybody else. And over 75 is about 79%. So we have a very highly vaccinated town. And I'm quite sure with all the clinics we just did for the 5 to 11-year-olds, every parent that wanted an appointment got one, because we vaccinated about 1,300 kids. So
Wow.
I feel good about that. We've gotten that done. So that's kind of where we're at. And you've got last week's and then this week's COVID dashboard. Tricia sent the new one on Wednesday. There are 16 new cases in the last 7 days. The week before that was 20, and the week before that was 25. So, you know, that just seems to be about where we're hovering, between 15 and 25 per week. So that's where we seem to be at.
Going back to the webinar, one of the questions I had on that was, there's a statement here. It says, when you talked about having to encourage people to notify their close contacts, that it's being left up to the individual. It says, if unwilling or unable, assist them in doing so. So have you encountered people that are unwilling or unable and had to offer that assistance? How does that actually work?
I'm sure Tricia has, and she would follow it up.
Mm-hmm.
Tricia is meticulous.
Okay.
You know, I mean, I'm sure she's encountered, I know she encountered parents last spring who would not say who their kids were with. And she would ask nicely and cajole and try as hard as she could to get the information. I mean, a few people I think outright refused, and what are you going to do in that case? But, you know, Tricia will go the extra mile with everybody, if that's what it takes. The other thing I will say is that, you know, we're in this regional public health. We got the public health excellence grant money. The town of Wayland just applied on behalf of all the towns in that group. And they got $484,000 for FY22 and 23 to hire contact tracers. So they will be doing that. So Trish will continue to focus on the kids' cases in the schools, but she may give some of the adult cases to the other contact tracers, because she's always focused her efforts on the schools.
That's great. All right. Thank you. So I know that the Mass Medical Society came out today and said that, indoor mask mandate is something that they're recommending. I know that when you look at the CDC website, they really strongly support indoor mask usage. It seems like the tools we have are vaccinations, mask mandates, and recommendations for social distancing and such. And with a 95% vaccination rate, we're not going to get too much greater than that. And I know that as I go about my day in this community, almost everywhere I go, I see people wearing masks in the stores. And that's without a mandate. It seems like people tend to know what to do or are doing what they feel comfortable. There's no control over people that are coming here from outside of Concord, but obviously we don't know what their behaviors are going to be. We can't anticipate. So how are people feeling about an indoor mask mandate? Board members.
I feel it's a step backwards, and it almost is putting the vaccinated folk as a waste of time for having got vaccinated. One could interpret it that way.
I have a slightly different read on it. I'm actually in favor of it. I think it's a useful tool. I think that historically we've seen, the colder winter months when we've seen spikes. I agree. I think that a lot of people are already doing it, but it does help, particularly store owners. And I've heard from at least one of them where, they feel sometimes under the gun because there isn't a mandate when people come in when they're maskless. So I think we're moving in a direction where I think more caution is prudent, and so I'm leaning in favor of enacting a mandate.
Yeah, when I was looking at the numbers, so in early October, it was the 14-day positivity rate, the percentage was 1.08, and now it's at 2.51 as of December 4th. So it's more than doubled since the beginning of October. And I do think that with more people spending time indoors and that possible role of the drier air playing a role, there is a concern.
I was looking at similar data, Jill, and the state rate is 4.79%. And then I looked around for, surrounding communities, and fortunately, and I think that speaks a lot to the work that Susan and staff have done, but, we have a relatively, that is 2.51 is relatively low, but then you look at Maynard at 4.51 and Billerica at 8.96. And those are to some extent adjoining communities or abutting communities, and people do come in and out of Concord from other communities. So, I think to some extent we're safe and we have a high vaccination rate, but I'm just alarmed in the direction where where the positivity rates are going up, and and it's the colder weather is upon us. So I just sort of out of abundance of caution, I would that's why I would recommend us moving forward with it. I know there's some concern about how do we enforce it, and I think that's really valid, but there are a lot of other communities that have enacted mask mandates, and I know they struggle with enforcement, but I sort of would look at, say, the tobacco industry or what we do with tobacco, knowing that it's sometimes difficult to enforce sales to minors. We do have a mechanism that we can, a surveillance mechanism to address that. But there is a challenge, and I don't think we've shied away from moving forward with tobacco regulations. And I think we should not be concerned that we would be able to enforce every store in every instance. And that's sort of leading me to weigh the idea of reinstating the mask mandate.
I know that enforcement does become, a real challenge. Like, I don't know how we enforce it. Right? It's short of like catching somebody, in the act. We're not going, and do we issue fines? I mean, what happens?
Yeah, I mean, this, it'll sort of come back to a lot of the unpleasantness that was seen, the behavior, in the beginning of the pandemic, when the Board of Health got tons of complaints, about people not wearing their masks when they're walking in the woods, or someone biked right by me and they came within 18 inches of me, and things like that. I think it will bring back a lot of, it's just sort of complaints and bad behavior and so forth. I mean, I really don't want us to see us go have a mask mandate, just because I think we really are a community that got our kids vaccinated. We got ourselves vaccinated. We got our elders vaccinated, I mean, it's hard to argue against, the mass medical society's recommendations and stuff like that too. So I think if we moved forward with a mask mandate, I would want a very sort of short time limit on it. Or, parameters that say when our positivity rate goes back down under 2%, or, this is only until January, 1st or something like that. I would want a very tight time frame and parameter on it, because I think, otherwise it's just endless, I mean, the kids will be wearing masks in school forever, I think, at this point. So I would just want people to have a little bit of hope that it's not forever.
I would follow that up, Dr. Green, by saying, both Sudbury and Bedford have mask mandates, and both health directors in those towns are like, there's no endpoint to this. Like, at what point do we, their regulation was not written so that there's an endpoint to when the mandate goes away, and both of them are, will this be forever? So if you do it, I would agree that there should be some set of parameters for when it gets lifted.
And there's also the natural immunity that has taken place in the latter part of the year.
I mean, the state DESE right now says schools can start being unmasked when 80% of the students in the school are vaccinated. They don't have to be, but they can take that off ramp if they wish to. So that's the state parameter for schools, just for whatever that's worth.
Do you know what the Concord schools are thinking on that one? Since they'll probably be at that, if not already.
I think DESE is mandating masks now through January 15th.
That's right.
And then I think they're allowing schools to consider the off ramp, but I think, you have to have the test and stay program and all of that, which our schools have in place. But I believe they're going to let schools use that off ramp if and when the school decides it wants to. I don't know what school committee is thinking at the moment.
Mm-hmm.
Susan, did you want to mention what we discussed during that meeting about perhaps having the businesses be the ones that we talked about, the businesses putting their mask, having their own mask mandate for their individual stores, or like a supermarket or food service?
Well, I will tell you, I mean, it seems like most of the complaints we get from citizens are they're not happy with grocery stores. I don't want to name names that don't require their employees to wear masks, and they don't like some of the larger restaurants that don't require their employees to wear masks. Although in a restaurant, everyone is sitting there for an hour with no masks on anyway. So I'm a little bit like, well, what difference would it make if the employees were masked? Nobody else is.
Yeah.
Protect the employees. But
the employees aren't sitting 3 feet across the table from you, breathing on you. It's your friends, but.
Yeah. I think I was at the Umbrella last week, and there's a sign in there hanging up that says that masks were required per the order of the Concord Board of Health. And I don't know whether it was a vestige from back when we did require it, or whether they were just putting our name out there to give it a little bit of more authority. It was unclear, and I didn't follow up on that. But I also didn't stop them from having it while they were. It's like, well, if that's what you need, go for it. But I think it would be great if stores did do that for themselves. Because when I think about kind of a small office, with 2 people who are working in the shared office space, then they know they're both vaccinated and they have a sense of their comings and goings. I'd hate to put something in place for a small business like that, making it very uncomfortable. On the other hand, I do think that, a supermarket should have it. So I struggle myself with where this should be. Mark, you've been really quiet. Any thoughts?
Oh, I do think it's a tough issue. I was in the Concord post office with my daughter on Saturday, and I was shocked when there were 2 different customers behind us that didn't have masks independently. We still were able to keep 6 feet away. We still had our masks on. I think most places people still have masks on, and then every now and then you see one person without, and it's a little jarring. But I don't know that one person actually makes me feel unsafe. I just stay away from them. And I do think there's something to be said for letting businesses have make their own decision. If the business community really wants and needs us to have a mandate because they need that cover, that's maybe a different discussion. But I don't know that I'm willing to bet that we would probably hear just as much one way than the other way if it was a mandate. I wonder if there isn't something we could do that's a little bit of an in-between that says, the Concord Board of Health supports a mask mandate by any business that chooses to invoke one. And if the business has a sign that you have to have, you have to wear a mask, then that's enforceable by the town, something like that. I don't know if that's feasible or not, Susan, but it's sort of an in-between where it gives a business owner that wants a mask mandate for their store kind of the blessing of the board on it, but it doesn't make every business choose to do that. And then frankly, there's, let the market decide who's, some people may not be comfortable going to the stores that don't have one. And some people that, when the store has one may, object to masks and not want to shop there either, right? So I don't know, that may be some way to give the businesses a choice of, having the blessing of the board to let them impose a mandate if that's what they want to do.
But Mark, isn't that currently what's in place? Stores right now can require masks to come into the stores, and a couple have.
Yeah, I think they definitely can. I guess the question is it helpful to them to be able to say, per the Concord Board of Health, we've chosen to put a mask mandate in place for our store, right, which is enforceable by the town, something like that.
Yeah,
Again, I don't know if that's helpful or not. But
we could say that we recommend indoor masking, but not have a mandate, and then, I think, I have been out and about in town, and I think a lot of stores are requiring masks, but others aren't. So I wear a mask all the time inside, but, so I think it's sort of an individual choice. I think if we got the message from the, town's business owners that they overwhelmingly majority wanted a mask mandate and that would help them, then I think I would support that. But I'm not sure I get the sense that it's wanted.
yeah, well, and we've already been recommending it. And maybe it's as simple as if a business owner wants sort of the you know, the Board of Health's endorsement, its sign can say, as recommended by the Concord Board of Health, we require masks, right? Which isn't really us doing anything different than what we've already been doing, right? But it would make the sign that Jill saw at least accurate if it said, as recommended by the Board of Health, instead of saying as mandated by the Board of Health.
Mhm. Right. You know, I think it might, my sense is that the state is going to do this for us soon, maybe. Actually, I mean, the governor doesn't really want to, but it still might come to that. So we could be putting out stronger language than we have now, which is asking for that, giving the stores, you know, license to do this with our support, and kind of give a wait and see. And maybe if that threshold, that positivity rate goes, you know, significantly higher, if it doubles again in another month, then we do something about it, because we'll have few other options, you know, a few other tools to work with. As kind of a you know, still, we're still kind of in a wait and see, but ramping upwards towards it in this way. Is that reasonable?
Yeah,
That makes sense.
yeah.
Ray, you know, you were wanting one. Are you comfortable with kind of this stronger language, and then with that threshold of if it's doubled, if it's, let's say we're at, what did I say it was, 2.51, 2.51, if we reach 5% in January? It's like the trigger.
Yeah, I had a question. I was going to pose a question. What would compel us to issue a mask mandate? You know, what's the tipping point? Perhaps we ought to look at data and say, you know, that's when we will take action. I think the medical community, from what I can see, aside from the Mass Medical Society today, but even the medical community, as reported in the Globe the other day, is really pushing the state to enact the mask mandate. And some of the larger communities already have. Boston has one, and other communities. I know Chelsea's instituting one. So I think if we were to issue stronger language in terms of recommendations and stay away from the mandate, I'd be okay with it, but I'm still uncomfortable with it.
You know, but I think comparing it to Chelsea, where the vaccination rate is probably not as high, is just not
True.
necessarily a
Yes.
valid comparison.
Yeah.
Right.
Absolutely. I mean, we're not Chelsea, we're not Maynard, we're not Billerica. You know, our town has really responded to the vaccine mandate, you know, these vaccines. They've gone out, they've gotten them.
Right.
It's like 95%, I think, right?
I know.
Overall. That's,
We get a gold star.
you know, yeah, I think statewide it's 74%, you know, so we're so much higher than the state overall that.
And I think, you know, I think we just have to kind of keep an eye on the data every week. And, you know, Jill, we may need an emergency meeting if things really spike up, but, you know, I don't know. I'm not sure.
Yeah, I mean,
Well, we have a population that is very educated and very independent thinkers. And basically, I feel people are doing what they feel is working for them. And I love the fact that the vaccination rate is so high.
Yep. Did a good job.
Yeah, but I am comfortable with looking. I do look at the data every few days, and I'm watching it carefully. And you know, I can look for that threshold. You know, if it doubles really quickly, we can do something really quick as well.
Yeah, I think so. I'm comfortable with that.
I will resend you the Sudbury, Bedford, Lincoln, and Carlisle mask mandates so that you have them for your reference. I know we discussed them earlier in the fall, but I'll resend them so you have them.
Okay.
And they particularly weren't advising because they had so much fallout. Is that correct, Susan?
Both Bedford and Sudbury felt like it was a very polarizing issue. They got a lot of angry phone calls after they enacted it, you know, sort of
Right.
live free or die. Nobody's going to tell me, you don't have any right to tell me what to do kind of calls. I will tell you, Carlisle has been sued. for their mask mandate. And some town employees have been sued personally as a civil rights violation.
Ah,
Yeah. So I don't know the particulars of that, but I know the town's been sued, the Board of Health's been sued. So, you know, I think that's a risk that you get one angry citizen who really thinks that that it's an infringement on their civil rights,
mhm.
which doesn't mean you shouldn't do it, but just be aware of that.
Polarizing.
It shouldn't be.
Yeah.
Okay, so we'll revisit this. I'll be watching that data as more closely than I even have been. If the positivity rate starts climbing, I'll reach out to all of you.
Yeah, sounds good.
Makes
But
sense.
Jill, you mentioned that we would tighten the language a little bit, but stay away from the mandate. What would that language sound like?
I think, Mark, you had an idea on that. You're a good wordsmith.
Well, so what was our old language?
That the
Susan, do you
Board
have
of
it
Health
handy?
strongly recommends.
And then maybe it's strongly recommends and encourages business to require masks. Maybe that's it. And we encourage businesses to require them for entry or something like that.
Or we support the Board of Health recommends masks indoors, and we support businesses that choose to do so.
Chooses to require it for entry.
Yeah, we support
I
the
like that.
individual rights of businesses to do so.
Say that again, please. I'm sorry. That you're gonna, are they putting their own sign up and it's gonna say as supported by the Concord Board of Health? I don't, I think you have to be.
Well, they can put up whatever sign they want, right?
Okay,
So,
Yep.
so I think it's the Concord Board of Health strongly recommends the use of masks in
mhm.
indoor public places. And supports the
I think that's all you need to say.
Yeah.
I think you
Indoor
just say
public
we
places.
support the use of masks in
Well,
indoors.
it does say, excuse me, I'm sorry. It says right now, it says the Concord Board of Health endorses recommendations from other public health entities about wearing face covering indoors. That's what we had said at the September 21st meeting. And then we added the word strongly. The Concord Board of Health strongly endorses recommendations from other public health entities about wearing face covering indoors in accordance with CDC recommendations. And then there was a listing of recommendations.
So what we're saying doesn't really add to that.
No,
We added the word strongly, if you remember at the last. We went from endorses to strongly recommends and endorses. We added the word in strongly. That's
We
what we're.
reiterate our strong recommendation. We reaffirm our strong recommendation that that
Reaffirms that, okay,
yeah, we affirm.
it's
Mask
previous recommendations, okay.
You want me to write a new new news and notices to go out? I'll draft one and send it to you, Jill.
Yes, please. Thank you.
Okay.
Okay, Deborah?
Oh, as a retailer, I think I like the wording that, the Board of Health recommends indoor masks for all citizens, and just short and sweet. And that makes the life of a retailer much easier too. So either we recommend or we mandate, but I don't think anything in between is needed.
Yeah, well said.
Yeah, and we do it. We do recommend it. Okay, so Susan, if I can look at that as soon as you get it to me.
Yeah, I'll do that.
Great. The other issue we said we would revisit along these lines is vaccine requirements for the BD Center. Because there had been some concerns that were raised earlier. I have not heard recently about people who in mask wearing is viable for people who are using the gym, but not the pool. And if we're not checking for vaccines, people in the pool don't know that they're necessarily protected. So, and there's a lot of people, it's one of the few things I can do right now. I would like to be swimming, and it would be good to know that I am in there with vaccinated people as well. Even though with a vaccine, I know that I'm protected, and I am vaccinated. Sore from my booster in this arm too today. So is this I know the town earlier was looking into, I think, some of the legal issues. Susan, I don't know if I've ever heard back from Kate Hodges on that one.
No, I don't think so. Yeah, I kind of dropped the ball on that one, and I'm sorry. I think if you want to make a recommendation that the BD Center require people be vaccinated to use the pool, I would go ahead and make that recommendation.
Yeah.
There may be legal questions or issues to be resolved, but at least you're on record as making the recommendation if that's what you feel you need to do.
And is the recommendation made to the rec department? Who's the recommendation made to, I guess, is the question.
I would make it to the select board, I think. I mean, the select board and the town manager.
So something along the lines of, given the inability to properly mask when swimming, we recommend that vaccine status is checked for users of the BD Center or users of the pool.
Yeah. I mean, they're vulnerable in the pool, and I think it's reasonable to ask people to show proof of vaccination. So I would agree with that.
I mean, we're asking,
It's proof of vaccination be required, right? It's not just checked, it's proof of vaccination be required.
Yeah.
For users of the pool. I mean, is it just for the pool, or is it for all of the BD? I mean, the vaccines are, masks are required elsewhere in there, but just not, you can't swim with one. Ms. Levan, you have to unmute.
Thank you. I wasn't sure if this was appropriate for public comment.
Can you please introduce yourself and say, give us your address, please?
Laura Levan, 58 Nimrod Drive. And I'm a user of the pool, the BD Center, and I am fully vaccinated. And this is a big issue for me. The Umbrella required proof of vaccination to go into their facility. And you had to bring your card and they would stamp your hand. So some places, and I've been to other places in other towns, but some places do require it. And I think the pool is a great place to require it, because especially as more people started taking classes and they started opening up the BD or the pool classes, we are closer to one another. And I happen to know of one person that is not vaccinated that goes to the classes I go to, and I just make sure I keep my distance. And yes, I'm fully vaccinated, but that's, we can still get COVID, we can still get breakthrough cases. So I'm a person that wants to be very careful. So I would strongly recommend the town requiring proof of vaccination to use the pool. And I just think that's an obvious thing to do.
Thank you. Ms. Daly, please introduce yourself with your address and unmute yourself. You're still muted.
Am I unmuted?
Yes.
There you
There
go.
you go.
Okay, I'm Alice Daly, 1713 Wedgewood Common. And I too am a member of the pool and I'm aware of somebody who's unmasked. And we're moving in the pool. We are not 6 feet apart. And when she comes, everybody moves to the side and you're kind of engineering yourself to not be close. It just doesn't seem right. And she's not vaccinated. And I think there should be proof because she's within 6 feet. And especially when as we move and you have more people in there, she'll even be closer.
Thank you. Yeah, no, it seems like an obvious. And so I think sending recommendations to the select board seems reasonable on this one. We recommend proof of vaccine for users of the pool, and they can have that on file. I mean,
Yeah.
shouldn't be a burdensome thing for the pool to collect that.
Mhm.
Don't cheer yet. We're just recommending, we're recommending it. So are we all in agreement? Do we need to make a motion on that?
Could I say something?
Sure. With your name and address, please.
Yes, Linda Corbett, 166 Laurel Street, Concord. When you say you recommend, you don't recommend that it be required. What does your recommendation mean?
No, we recommend that people are vaccinated to use the pool. So
Yeah. Recommend that it be required that people are vaccinated to use the pool, because to me, recommending sounds like you're suggesting it's a recommendation, but it's not a requirement. To me, they're two different things. So what's your meaning in that?
you're right. I guess I would like to see that it's required to use the pool. That would make sense.
Well, we're recommended that it be required because we don't have the authority to make it. So per se, we're sort of encouraging the town to do it if, you know, the legal issues and whatever, let them do it, which we don't know the answer to that.
That's true.
So you just will say you recommend it, is that,
Recommend that it be required.
okay?
Recommend that the beauty center require proof of vaccination to use the pool.
Thank you.
Yes.
Right.
Thank
I guess we have to remember there are children under 5 that use the pool. So
Yes, right.
I guess it's, you know, but hopefully they're just in the little kiddie pool. But I guess that is, you know, something that would be hard to enforce. Right. So do we have a motion?
I moved that we send a recommendation to the town manager and board of selectmen that the BD Center require proof of vaccination to use the pool.
Second? I second it. All in favor, Alma,
Yes, I am behind that too.
Ray,
Yes,
Mark,
I approve.
and Deb?
I approve.
Okay, great, thank you. So we will submit that recommendation to the select
Joe,
board.
I have a quick question. Does the BD Center require masks while they're working out?
They do, but you can't wear one in the pool.
No, of course, but
Yeah.
the center does require masks.
I believe so.
Oh, okay, great.
Yeah.
Thank you.
And I know that in the pool, I haven't been myself in a while, but perhaps the swimmers here can tell us, is it that you still have to wear your mask until you're in the pool, but even on the pool deck, you have to wear it? Is that the case? Go ahead.
I'm not sure it's required, but many of us do. They even have a little hook by the shower on the pool deck where you can put your mask.
Mhm.
So, you know, a lot of us do wear a mask. I haven't seen anything that says it's required, but
I just remember in the beginning that was the requirement. So
Yeah.
I just, I haven't been in myself for a bit. Okay,
And
I think
say,
most people do not wear them. I wear one and take it off when I'm entering the pool, but I see very few people doing that.
Okay, well, we'll try.
Exactly.
We'll
Thank
try.
I was just going to add that, you're concerned about the younger people. I mean, in your wording of the recommendation to the town, you could say those that are eligible be vaccinated, show proof of vaccination. That
Or
lets the ones that are under 5 off the hook.
or couldn't you just say the adult pool?
No, I mean, you want it everywhere. So, all right, we'll figure out the wording. Thank you all for your comments and input.
Thank you.
Okay, moving on to staff reports and other health division announcements. Susan.
The only thing I have to report is that we've completed the second dose clinics for the 5 to 11-year-olds. The last one was last night. In total, we've done about 1,300 Concord and Carlisle kids, which I think is great. We've been fortunate to get the DPH mobile vendor service to do it. They are excellent. They're a well-oiled machine. We did 700 people last night. And CDC and FDA last week approved or recommended booster shots for the 16 and 17-year-olds. At the clinic last night, we were able to offer some adult booster appointments because we didn't fill all the appointment slots with the 5 to 11-year-olds. So we did some number of adult boosters, and Tricia is going to try to get the mobile clinic scheduled for early January for booster doses for 16 and up.
That's great.
So we'll just keep going.
Wonderful. Other staff reports? I see Gabby's here.
And Casey is here. I have not introduced Casey. Have you all met Casey Mellon yet? He's our Assistant Public Health Director.
Is he still
No, he
here?
wouldn't have. Did he leave?
I
He
saw
was
him
here.
earlier. I don't know whose phone,
Yeah.
it's just iPhone.
No, Casey, you're not here. He left.
Yes, I should have introduced him at the beginning of the meeting.
It's okay. Well, so he's the new Assistant Public Health Director. I'm just really curious. For the January meeting, does he sit in your place for that?
I believe he will, and Gabby may sit in too, and I believe Marcia also plans on sitting in.
We'll be all sitting in, Joe, not to worry.
Okay, good. I'm worried. I'll miss you.
Don't worry.
No worries.
Don't worry. I've been here a long time, not to worry.
I know I can rely on the two of you that are here, but nevertheless, any other staff reports?
No, I can't think of any.
Susan's retiring. That's a big report.
Big report.
It's
You know,
under staff report.
and then when I think about board member reports, Susan and I started working together in September 2012. That's, so that was shortly when you came on, right? And
Yeah.
Susan was able to, she had the foresight to apply for a Healthy Communities grant. And I think it was through Gabby, actually, that maybe you were alerted to me and hired me to help you with that.
Raise your face.
You did an outstanding job, Jill, characterizing really relevant issues that continue to be relevant today, 10 years later. We
It's really
identified
amazing.
transportation, and I believe the town is going to put a transportation planner in the budget. We identified youth mental health, which continues to be a topic. I had lunch today with Jen Clark, who's our former youth services coordinator. And we just were talking about her youngest daughter graduated from high school last spring. And we just were talking about the effect that the whole pandemic and the isolation has had on kids, that they've missed years of socialization and schooling.
Right.
And we think it's going to there's been real impacts from it. So I think, Jill, that the issues you identified in the community were the right issues, and they're still with us today.
I'm sorry that they're still with us today, but I'm glad I was able to identify it 10 years ago almost. And so glad that you had, the opportunity to bring that to this community. So, good job on that. So.
And I think the community's made a commitment to trying to solve some of them.
I think they have actually, and I'm glad for that. And I'm just sorry that you're leaving us, but, really wish you well as you figure out the next stages and take care of yourself and stop having to be a regulator.
Yep.
So you will be missed for sure. It's been nice having the stability and your very steady hand,
I
leading
will
this
miss all of
department.
you. You are a really good board. I want you to know what a really, I've never doubted all of your commitment to public health. You've shown it time and time again how completely committed you are and your deep understanding of public health. And that's really the best kind of board of health anyone could have.
Say it all the time, don't we, Susan? You
Yep.
have the best board.
Oh, I'll blush for all of us.
It's true.
True. It's true.
Wonderful. Thank you. Any other board member reports?
I would just quickly say that a real positive thing happened last week. Governor signed the ARPA bill for the state, the American Recovery Act bill. And in that signing, I forgot how many billions it was, like a $5.8 billion, but in that is $200 million for local public health. And that's going to trickle down to boards of health and to health departments and for additional staff and credentialing and training and even equipment. So I think that's real good news on the local level for us. I'm not sure when the money will start flowing, but probably to some extent in the spring. And it's 5 years of money, and it's about $45 million a year for public health, additional money for public health.
Wow, that's wonderful.
Do you have is there any sense of what the parameters will be on how local boards get to use that?
Well, I think they're going to emphasize, further shared services. I know we're doing that with Bedford and Wayland and those other communities. Susan was involved in writing the proposal for. So there'll be more of the shared services. I think strengthening local board capacity. I think there's going to be more training for board members in that capacity building, and there's going to be workforce education so that credentialing of public health personnel and more robust data collection, particularly for Western Mass, not so much our departments here, but Western Mass. There's even, I think there's about $5 million a year for technology upgrades for local boards of health, for local health departments, with more laptops and tablets and computers. So a little bit of everything, I think, in for boards. And then more data, more emphasis on data collection too.
That's right.
Yeah, all good news.
There's Casey. Casey's back.
Casey,
Hello.
are you back?
Yeah, I'm
Yeah, I
here.
see it. I
Would you like
can't
to
get,
introduce yourself?
Can people hear me?
now we
Yes.
can.
Yes.
Hello, my name is Casey Mellon. I started back in late October, and so far so good. Primarily just doing a lot of septic. I mean, there's a lot of the housing boom and what have you, and a lot of backup with stand out and what have you. For pretty much in Concord has been pretty much septic straight out. Getting a little breathing room soon. I think the winter is going to start to slow down a bit, so I can start focusing on other aspects of the job. But all in all, it's going well. Nothing really.
Casey was previously the assistant director in Lexington, and you were the director in Northborough, and you've worked in
Drake.
Woburn and Drake.
Drake, yep.
What am I
Yeah,
missing?
Woburn, I was there for about 10 or 11, about 10 years as like the senior inspector.
So,
Yeah, then I ran a few smaller health departments for about 5 or 6 years, and now here I am.
Welcome.
Glad you're here. Thank you. Okay, board calendar is our next item. Soon it will be 2022.
Right.
Yeah, so Karen, I assume this was supposed to be the 2022 calendar. So you're on mute, but anyway, that lines up. So the only conflict, February does not conflict with school vacation, which is good, but the April date does. So I would ask on behalf of anyone else that's a parent also that if we could try to find a different date for April.
April often gets tricky with other holidays too. I don't know when Passover this year. Oh, it's earlier. Okay, but January 18th. Karen, you're muted if you're saying something to us.
Is January 18th okay, though, up until that point? Just let's do one
Yep.
meeting at a time at this point. Yes, and I'll fix the
Fine.
calendar. I'll change April and send you some dates.
Mhm.
I'm actually not available on the 18th,
Okay.
January 18th.
Okay. Are other folks available? Will we have a quorum if necessary? Okay.
It's not an ideal date for me, but I can be there.
Because what happens is it starts to conflict with other boards, even though we're on Zoom. I'd
Mhm.
still rather us not, like the planning board. I've been asked to try to keep our meeting not on the same day as the planning board,
Yeah, like tonight.
like tonight. So
Is the 18th free of the planning board? Is that a good night?
as far as yes, because I was looking at rooms, thinking that at one point we might be in a room, but we're not going to be. We'll be on Zoom, and they are not meeting on that night
Okay. Okay. So,
because I have to push them out for rooms. Okay. As of right now, if it changes, I will.
okay. All right, so that's the calendar. We're good.
And Mark on the minutes, I got everyone else's remarks, but I didn't get marks with a few grammaticals, like I said at the beginning. Not contacts, but I have not incorporated them because I just got them.
So are they ready to be approved then? Do we need to approve them?
I would suggest approving the September ones and the October ones.
Yeah, the edits I sent her are
There were
making
grammatical.
changes there that she sees.
It wasn't
fit.
edit, it wasn't content.
Okay, for either one of those. Okay. Okay, then is there a motion to approve the September minutes? Or I move to approve that we approve the September minutes. Is there a second?
I second that.
Second.
Okay, and Ray
I
It
approve.
wasn't there.
and Mark,
I approve.
Deb,
I approve.
and Alma.
I approve.
Okay, and I approve, and I move that we approve the October 13th minutes.
I second.
Okay, great. And Mark, how do you vote?
I approve.
Okay, and Alma
I approve.
and Ray.
I approve.
Okay, so I think we all approve. Okay, I think that was the last item on the agenda.
So Joe, I think you said it well, our thanks, but I would like to make a formal motion to thank Susan Rask for her exemplary service to the town of Concord as its public health director and congratulate her on her retirement.
Second that.
Yes, and I approve of that because it's excellent. And we have totally been blessed to have you, Susan.
It's been my pleasure, and it's really hard to say goodbye.
Oh, we'll see you again. We're not done yet.
See you Thursday.
You know, I hate saying goodbye.
But where is that? Is it at Keys Road?
Yeah.
Yeah.
You can all come on. Yes, I will, on the second floor.
Okay.
Okay, we will see you there.
We will have cake, well, coffee cake.
Start off the day
Coffee.
right.
All will be well.
Well, if that's that, then I think we're ready to adjourn this meeting.
All right.
All right, all in favor? Just raising. your
Aye.
hands.
Aye.
Okay,
Aye.
thank you. And Susan, we'll see you Thursday.
Okay.
Thanks.